Welcome to Understanding ACA Plans tutorial. My name is Jill Pedersen with Columbia Benefit Solutions. The purpose of this presentation is to assist our employers and their employees in transitioning from Keep Your Plan benefits to ACA benefit plans. Our goal is to educate and empower our clients so that they can make informed decisions about their health care. The Affordable Care Act is federal legislation that was signed into law in 2010. A few years later, in 2013, states were given the permission or option to keep their plans as a transition into the Affordable Care Act plans. In the state of Oregon, it was decided that all of these plans must end by November 30th of 2017. And these Keep Your plans do not include ACA benefits. The ACA benefit plans have 10 essential health benefits, and they also have many other consumer protections. So let's take a quick review about how your current plan works. For some services that you may incur during the year, especially those that are high-cost items, like perhaps an MRI, CAT scan, hospitalization, or even an emergency room visit, those services require that you pay a medical deductible first. After you have satisfied that medical deductible, you pay co-insurance. Generally, we see 20 or 30%. That means you pay 20% of the remaining charges until that 20 or 30% hits what they call a co-insurance maximum. So for a major procedure, you would pay deductible and then co-insurance. However, throughout the year, you will always pay your office visit copays, specialist copays, and your prescription copays. So during a calendar year, on a current Keep Your plan, you will have a deductible and you will have co-insurance. Those two things added together gives you a very large dollar amount. So if you have a major operation or something like that, once you hit that large dollar amount, then the insurance company pays 100%. However, you will always pay those outpatient copays and prescriptions throughout the whole entire planned year. Now moving over to Affordable Care Act plans. The first thing that happened with this new law is that they put together a required package of comprehensive services, and these are called the essential health benefits. There are 10 of them, and they are required to be on all plans for small group employers and individuals. Highlighting maternity and newborn care. This benefit was optional, and some states, for example Washington, allowed you to actually purchase a plan up until 2014 that did not include maternity. Of course, that is now a mandated benefit. Prescription drugs was also an optional benefit, and so some plans would have no prescription drug coverage or maybe only covered generic drugs. Another benefit that's been updated is rehabilitative and habilitative care. So rehab or rehabilitative is, for example, physical therapy. Habilitative care is a new update added to many plans that helps those individuals that are born with a certain condition habilitate to a better quality of life. And finally, another new one that we've seen with this essential health benefits is something called pediatric vision and dental. And that is a benefit that only applies to those that are under the age of 19. However, it is a required benefit for all persons, regardless of age. So if you are over the age of 19, you still must purchase those benefits if they're not included in your plan. So anything that happens to you throughout the calendar year in one of these 10 essential health benefits, all of the costs that come out of your pocket, your copays, deductible, etc., all apply towards what they call an out-of-pocket maximum. So this is different than what we saw in the previous slide with co-insurance maximum. So for a plan, an ACA plan, you can have deductible, co-insurance, copays, and prescriptions. And all of those items that you spend during the calendar year towards those essential health benefits all apply towards your out-of-pocket maximum. So it is possible if you have expensive medications, go to the doctor a lot, etc., that you could actually hit an out-of-pocket maximum without ever meeting a deductible. The other thing that the Affordable Care Act did was it wanted to give consumers the opportunity to compare plans side by side in an apples-to-apples comparison. In order to do that, the determination was made that every plan had to be ranked based on their value. And so how they did this was they came up with calculations and they lumped all of the plans into these different metal tiers. So you'll see platinum, gold, silver, and bronze. And those values are based on what your total out-of-pocket is and the percentage on average that you would pay. So if you enroll in a platinum plan, that would be the most desirable metal. You're going to pay the highest premium, it's the most valuable, but you will also have the least amount out of your pocket when you do have services, when you pay for prescriptions or go to the doctor. And so it goes down with every single metal tier, and by the time you get to the bronze plans, your premium is the least, but your out-of-pocket costs, or when you go to the doctor, the hospital, pick up prescriptions, then your costs will now be the highest. So this is important to note when you're planning and you know what your health conditions are and you're weighing out the cost of the premium versus what you would spend out of pocket. So the Affordable Care Act also made some changes and put some limits on what that out-of-pocket max could be. Previously, our current transitional Keep Your Plans, the insurance company would and can and could set that out-of-pocket or that co-insurance maximum fairly high, depending on what the market was allowing and what their members needed or wanted, and that, of course, kept the premiums lower. The Affordable Care Act came in and wanted to really protect consumers, and so now they've put a limit on what that out-of-pocket max can be. And so every metal tier has to abide by that. However, that out-of-pocket max only applies to your in-network providers. So if you have out-of-network services or seek care from an out-of-network provider, your costs will be higher than that in-network cap. And the Affordable Care Act is also going to adjust that out-of-pocket max every single year. So at the implementation in 2014, you can see that it was low at $6,350, and it has continued to inch up every year. So this year in 2017, that out-of-pocket max can be as high as $7,150. The other thing to note about an out-of-pocket maximum is that on the previous plans that we had, you could have up to 3 deductibles and 3 co-insurance maximums in a family. So if you had a family of 6, you could have up to 3 deductibles and maximums that would be met during the calendar year. The Affordable Care Act has a 2 family member limit. So you can't ever have more than 2 deductibles or 2 out-of-pocket maxes met in a family in a calendar year. So now let's take a look at how, hypothetically, this would apply to you in your life with a claim. So let's pretend it's the month of January. You have not met any deductible, you have not had any co-pays, you've not seen the doctor or picked up a prescription. And January, you go snow skiing, you hit a tree, you blow out your knee, and now you're in need of some serious surgery and you need an ACL knee repair. So in Oregon, this would cost about $50,000 in the hospital, including your surgeon fees and your anesthesiologist and the stay in the hospital. When you get out of the hospital, you're going to need some follow-up physical therapy, perhaps a few follow-up office visits with your orthopedic specialist, and you'll need some prescriptions. So what would this really cost you in either scenario? So trying to keep things as equal as we can so that we can kind of have an apples-to-apples comparison. Let's look at both plans and assume both of them are going to have a $1,000 deductible. Both of them will have co-insurance of about 20%. The Keep Your plan is going to have co-insurance max of $5,000. That means that after you've met your deductible, you pay 20% until you've paid another $5,000. On the ACA plan, it has an out-of-pocket max of $5,000. However, that includes that deductible, it includes that co-insurance, and it also includes co-pays. So let's kind of look at a few line items in our hypothetical situation. Both plans are going to have a deductible of $1,000. And next we're going to start paying that 20%. And on the Keep Your plan, you're going to pay 20% until you've paid out another $5,000. The Affordable Care Act plan doesn't have a co-insurance max. It does have an out-of-pocket max. So the Keep Your plan, that wouldn't apply, but on the ACA plan, that out-of-pocket max was actually $5,000. But you've already spent $1,000 on a deductible, so now you're only responsible for an additional $4,000. You're out of the hospital, it's time for that physical therapy. On the Keep Your plan, you may spend, $30 a copay for 30 visits, that may be $900. The Affordable Care Act plan, you've already hit your out-of-pocket maximum, so you're not responsible for any more charges. So same thing with our office visits. Copays on the current plan, nothing on the new plan. And again, the same thing with our prescriptions. So this skiing accident, our claims could be upwards of $56,000. Our current plan, we would have spent about $7,900 out of our pocket. And on the ACA plan, we would have been capped at $5,000. Again, this is assuming that you have sought care and received care from only in-network providers. Because again, we're trying to give you a hypothetical situation on how this might apply. So just as a quick reminder, the Keep Your Plan and the ACA plan had similar structure and similar benefits, with the biggest difference being that coinsurance max versus an out-of-pocket maximum. And so what we actually spent when we needed care was significantly less with the ACA plan. Most likely your Keep Your Plan or your current plan has a much lower premium. The ACA plan is going to have a higher premium. And then when you go to the doctor, your current plan or Keep Your Plan is going to have higher out-of-pocket costs. The ACA plan is going to cost less. So just as a wrap-up on what the ACA plans look like, there is a required package of comprehensive services known as your essential health benefits. And everything that you spend during the calendar year that comes out of your pocket goes towards that out-of-pocket maximum. The ACA also has a cap on what that in-network out-of-pocket maximum can be. The plans are ranked into different metal tiers: platinum, gold, silver, and bronze. You're going to probably have a higher premium on an ACA plan, but you will have lower out-of-pocket costs. Thank you for joining me for this brief overview of transitioning from a Keep Your Plan to an ACA plan.